Now, what may have been the most important counterproposal to the Republican healthcare bill has just been killed in the state of California. And it was killed, of course, by a Democrat. Well, you think Republicans control California? No. It's a Democrat. Now, last week, California Assembly Speaker Anthony Rendon had announced that he was basically going to put this single-payer bill on hold. Now, in what could have been a defining moment for healthcare in this country, and certainly in California, as the Republicans, of course, continue with their ridiculous healthcare plan that's nothing more than a giant tax cut and a middle finger to the poor and elderly, Rendon, he essentially, who was, again, he's a California Assembly Speaker, essentially put a knife in the back of progressive reforms that could actually have, showed the American people a real alternative to what the Republicans are putting out. Because, again, what we had before, the irony here is that what we're trying to save, save the ACA, save the ACA, we're saving a right-wing healthcare plan against an even worse right-wing healthcare plan. That's the irony. This single payer could have been a model for the entire nation to follow. But, unfortunately, in tabling this bill, Rendon has made sure that it will never reach a vote in the House. It will, in the words of Hillary Clinton, single payer will never, ever, ever happen.
Yeah, and Rendon has received over $36,000 from drug makers.
We'll get into how much money he's taking.
State in general, including Jerry Brown, have received a combined $370,000 from groups opposing single-payer health care legislation. And also since 2010, these lawmakers have received $3.4 million in campaign donations from the health insurance industry. This is from The Observer. So yeah, this is another example of you can follow the money. Rendon has made a bunch of bullshit claims about why he's doing what he's doing. He's saying that it's incomplete. There were some articles early on that it would be too much money to unfold. However, even those were debunked early because other analysis revealed that even if we did nothing in changing the way we pay for it and just kind of throw it onto taxes and don't have any structure like we're going to tax the rich a little more or whatever else, even if we just unfolded it as is, the state would still spend less on health care than they currently do. They would still spend less domestically on health care than they currently do in the current model.
Wait, Ron, do you mean that if we were to cut out the middlemen who skim money from the top of insurance premiums, basically say to the insurance companies, we don't need you anymore because all you're doing is this, you're sitting in the middle between me and the doctor, and actually put forward a single payer, that's what they call it, right? Single payer model, where the government pays the doctors instead of you paying the insurance company to then pay the doctors, and then they skim money off the top for their profits and executive compensation. That would actually be more efficient and cost less, right? That's what you're saying?
That's correct.
I call that socialism.
Yeah,
that's socialism.
Even if you do nothing. And the statistics are out there. And you know, this Rendon guy said, well, I favor single payer, but the money, you know, I just don't think this is complete. There's no funding for it. Well, all that had been debunked. There is funding for it. There is a proposal on how to reevaluate the tax code to pay for this and pay for it quite easily. And again, even if nothing would have been done, even if they just would have been like, hey, fuck this, we're doing this and we're paying for it, the state as a whole would still spend less than they currently do. So even, I mean, there were a bunch of scare tactics out there saying, oh, it would cost more than the overall GDP of the state, so it's a pipe dream. But that was before any financial analysis had been done within the bill. And people observed that, yeah, but they're spending all this money on health care as is, the citizens are. This would still be a less total than what citizens in California are already spending on health care as a state as a whole. So it's very incomplete cherry-picked data. And there has been other analysis on how we could pay for it. And it's actually very attainable in this state. So Anthony Rendon, when he says, oh, well, I favor single payer, but I don't think the money's there. Look, a while ago, my girlfriend and I decided that we wanted to go see Book of Mormon. I had gotten Book of Mormon tickets as a gift to me, but unfortunately, I could not use those tickets because I had to go to Chicago. So I was going to be out of town. So what I did was I sold those tickets, and then with that money, we got other Book of Mormon tickets. See, at first, I was worried we weren't going to sell the tickets, and I said to my girlfriend, hey, I don't know if we can see Book of Mormon. You know, we only have so many leisure dollars, and I feel like that's an expensive ticket. We may need to put a pin in that. But then what happened was there was money there because we sold the other tickets, and then it's like, oh, well, with this other ticket money, we're going to get that, we're going to use that to buy Book of Mormon tickets. If I would have known that the money was there and still said to my girlfriend, hey, let's not get the Book of Mormon tickets because I'm worried we don't have enough money, you know what that really would have meant, Jeff? That would have meant that I didn't want to actually see Book of Mormon. So when Rendon says, oh, I favor single payer, I just don't know if the money's there. Meanwhile, there's analysis out there that says the money is there. You know what that means, Jeff? At least in my tiny mind, and using my Book of Mormon example here, it means that Rendon doesn't actually want single payer. That's what it says to me. Because the analysis are out there. We do have the money. We can pay for it. California can do this. They have the 6th largest GDP in the world. We can do this in California. So I think he shelved this because he doesn't want it. And he knows that Governor Brown doesn't want it either. So people need, and I'm actually, after this show, I'm calling him. You know, I've been meaning to call him at some point today. As of this morning, because somebody called into the Stephanie Miller show, they had been trying to call him, and they said as of this morning, he has received so many phone calls, all of his voicemails are full. So that's the one silver lining here. I think if people scream loud enough, he may have to do something about this, and that's what needs to be done because, you know, California is not only letting down our states, we're letting down the entire country because, like you said, Jeff, it's up to a state like California or New York or wherever else to kind of lead the way, on this because I think that's the only way we're going to get to single payer, at least in the near future, is if it's a state-by-state pursuit and if the states demand it. So we have a golden opportunity here in California, but we also got some dino corporate Democrats, Dianne Feinstein, Rendon, and even Governor Brown that are going to try to stand in the way of it, and we really got to push back. I mean, Dianne Feinstein has been very public that she does not support single payer. Nancy Pelosi doesn't support it. So we got our opposition, and it's really a shame that those oppositions are Democrats. But we know that that's the way of the game as of recent, and you know, we got to try to overcome it. We really do.
Yeah, I mean, look, with Democrats like that, who needs Republicans? If they're gonna, you know, block progressive policy, what's the point of them being Democrats? But as you pointed out earlier, there's that $3 million, $3.4 million from, you know, health insurance companies and you know, given to Brown and Rendon. So this is a great example of how money corrupts a democracy and how it actually stops something that a majority of the American people at this point want. And I think you said in the last segment where, you know, how can a bill that gets 16%, you know, referring to the Trump Care bill, possibly be considered when something that's incredibly popular nobody talks about? Well, it's the money. You got to follow the money.
Yep.
Look, this bill was an opportunity to give Americans a vision of what could happen if you actually vote for progressives and vote for Democrats. But of course, the Democrats, they don't like that. Their donors don't like that. So we get the same old status quo, funded, of course, by big money and the health insurance lobbyists. So if you're wondering what the hell's wrong with America, why we can't do what every other industrialized nation has done in the world, there's your reasons why. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.